I was always interested in being on the water, so that's my passion, is really to get out on the water. It became difficult when I got sick because I wasn't able to handle the boat by myself. I didn't have any symptoms that I could say was a heart disease. It came on very suddenly, and it was fluid in the lungs. I drove myself to the emergency room one day at 5 o'clock in the morning because I couldn't breathe. I could hear a gurgling. It was just gurgling along. So I brought a cardiologist in, and immediately he could tell that it was the right ventricle, the pump was not functioning. You know, it was in and out of surgeries, in and out of medications, try this, try that. They told me that sooner or later you're going to wear this heart out, so you are going to need a transplant. At the other hospital, I was treated there for quite a few years, and the one particular doctor, the congestive heart failure doctor, had a close friend up at RWJ in the transplant team, Dr. Dulnawan. Dr. Dulnawan set up an appointment with me to go up and see the transplant team.
So he basically took a fishing trip to Florida, and at that point he wasn't feeling well, so he came back to New Jersey, and from Newark he came directly to our emergency room. When he came in, he was very sick. His organs had started to fail, he had pneumonia, he had infections.
And that's where they told me that you're not leaving here without a heart. But I hadn't gotten out of bed in probably 45 days, so I had lost a lot of weight. I was probably 50 pounds down and not much left. There wasn't much left to me. But they maintained that they were going to get me in good physical shape, that everything would be running.
And after a long multidisciplinary team meeting with Dr. Ikigami, who is a surgeon, with Kelly, and of course Keith, decision was made to put in an impeller. An impeller is basically a temporary mechanical support device. It's a device that, is inserted through one of the arteries in the chest. With that, he was able to get the supply it needed. His kidney function became better. His liver function became better. We were able to treat his infections. He slowly started to regain his energy.
So January 7th, I was listed. January 8th, Dr. Iyer came in and told me that they found the perfect heart for me. January 9th, 2021, my kids came in to see me. They were completely gowned up. When I woke up on January 10th, I remember seeing a window in front of me, and there was a nurse sitting right in front of me. It was amazing to see her face, and I'm looking around the room, and not only did I feel 1,000% better, but I could see better. I mean, everything about my body, I could feel, I could see. Mentally, I was in so much better of a place with the new heart, with the transplant, that I decided to get on an internet dating site. My pictures that I had put on the site were all fishing pictures. If I was to find somebody, they knew that, this was my life. Sue sent me a little, I guess it's like a friend request kind of a thing. And she said, the one fish I'm holding is a striped bass. And she said, nice striper. I said, okay, that's good. She could pick out the fish from, any other ones. It has been such a wonderful ride with her. We go out, she has a boat, I have a boat. We do things together. We've been to the Cayman Islands. We've been to Florida several times, but we're going to go to the Keys to go fishing in the winter. We've got so many plans. We've got so many things in common. I am so fortunate that I met her. I had no idea that all these people were involved with my transplant. The number of people that they have that are so compassionate, I've never seen anything like it. Other hospitals are good, but this one, it just blows it away, especially the transplant team.